What's going on, guys, and welcome back to the world's okayest physical therapist podcast. It is me, Dr. H, your host, and today we are in the final episode, the finale of our inflammation series. This is going to be a nice recap of everything we did. So, if this is your first time listening to the podcast and somebody sent this to you, say thank you to them. And if you haven't sent this to anybody, you should, because everyone needs to have this sort of information so that way they can navigate the Byzantine labyrinthine system that we call the healthcare system to make more informed and educated decisions in order to also have better conversations with their healthcare providers to figure out the care that they need. That's the reason why I started this podcast. It's the reason why I maintain this podcast. It's the reason why we are 20 some odd episodes in. And in order for me to keep doing this, please consider joining the Patreon. Please consider checking out 10,000. Their shorts are amazing, their shirts are amazing, their pants are amazing, and in the description below you will find 15% off, or check out the store to buy merch for the podcast. Now, without further ado, let us dive into this final episode here. The integrated system, mind, movement, and inflammation. We're going to zoom out and look at the big picture and how the mind, movement, and the immune system all work together to manage inflammation. We're going to explore the neurological and psychological components of recovery. And we're also going to take a look at how movement, strength, active range of motion, and mindset all can play a role in how to bounce back from inflammation to get back to your previous level of function and doing the things that you want to do. Now, as we've talked about several times, inflammation is a process that your body undergoes. It's something your body is regulating, and there are ways for you to modulate that inflammation. When a tissue is injured or stressed, chemical signals are released that trigger inflammation locally, but almost instantly, like we talked about with the cytokines and cell-to-cell signaling. The nervous system and the brain are going to be involved. The brain is going to be trying to figure out and picture where the damage is and if it's a threat, and it's going to be trying to prevent future injury. So that might lead to it shutting down muscles, as well as other things. It will, like I said, I think 2 or 3 episodes ago, it will literally change the homunculus, which is the map of the body that the brain has, and it will magnify specific areas where trauma has occurred in order to have a better picture of exactly where in the body the trauma has occurred. And it will also dial up those nerves in that area to see if they're getting any sort of increased pressure or increased excitability in order to kind of map out where it thinks that the damage has occurred. Now, this will also adjust movement, and it will also adjust immune activity actually as well, with increased recruitment of immune cells coming into the area to make sure no bacteria, fungi, viruses, or whatever are going to start to propagate, and also to break down any sort of damaged tissue. This means that pain and inflammation, though, are not always equal. Your brain is going to have to filter what's happened in order to determine what level or threshold of pain it thinks is relatable. It thinks that is equal to the trauma that's been done. So if you have a paper cut, your brain is going to eventually come to the conclusion, it's a paper cut, I'm not going to lose the limb. But if you have significant trauma, the brain might be very confused about losing the limb and therefore overinterpret any sort of injury that's happened to this is potentially life-threatening. So one of the things that physical therapy can help with is not just the muscle and the bone and the movement, but also helping educate individuals about how the brain has changed to perceive whatever injury has happened and how to best conceptualize what has happened in order to understand why the brain's doing why it's doing, why the body's doing why it's what it's doing, and then how inflammation is playing a role, why the body is trying to go in and swell things up and break things down before it can go in there and build. Now, the neuroimmune connection is what we're going to talk about next. And the nervous system and the immune system are constantly in communication. Cytokines, like I talked about, from the immune cells influence how the nerves fire. It makes them more excitable, makes them more likely to say, hey, I'm in pain, or hey, I'm under increased pressure. And that's one of the reasons why when people get injured, they say, hey, I have some numbness, I have some tingling, I have increased pressure, everything hurts. Why does it ache so much? It's the nerves doing their job to keep the brain in a constant state of being fed information about what's coming from the body. Sympathetic nerve activation can also increase inflammation, and parasympathetic can calm it. That's one of the reasons why, if your body's in a constant state of stress in the sympathetic activation state, it's going to be more likely to increase inflammation because some of the hormones that are going to get released are going to be pro inflammatory. While when you're in the rest and relaxation parasympathetic area, you can you would have a less likelihood of those hormones being released, and your body's be more interested in trying to build up muscle and relax. One of the nerves that plays a pretty significant role with this is called the vagus nerve, and it plays a role in helping calm people down. It's one of the ones that's related to breath. So one of the reasons why you hear people talk about breathing meditation, for example, quite a bit, is basically what you're doing is you're using the vagus nerve in order to enter into a parasympathetic neurological response in order to try and drive down inflammation by influencing your hormones by breathing. And this, of course, starting with breathing, then changing the hormones, hopefully gets down all the way to the cell level to influence the immune system to not quite be so aggressive and pro-inflammatory, and instead just try to have the appropriate response to whatever trauma that's happened. So when a physical therapist or anyone is trying to talk about the benefits of deep breathing, gentle movement, relaxation, etc., it's not just about reducing stress. It's actually about trying to use breathing to stimulate a neuro response of the vagus nerve in order to drive the brain into being more into a parasympathetic relaxed state to release hormones in order to try to modulate and reduce the amount of pro-inflammatory hormones that are present in the body. In effect, the simplest way I can put it in one sentence is using breathing to fire nerves to try and get the body to come back towards homeostasis in a normal state that's not pro-inflammatory. I know that was a mouthful, but thank you for hanging in there with me. Now, how does movement regulate inflammation? Well, movement is one of the most powerful anti-inflammatory tools that is in a physical therapist's repertoire, and when it's done right. Muscle contraction acts like a pump, which will help move lymphatic fluid through the tissue and clear any inflammatory byproducts. It will help clear excess fluid and drive all that fluid back towards the heart, keeping this constant cycle of flow of new nutrients and oxygen and immune cells into the area while pumping out all the things that need to get out of there. This is particularly true when you think about any sort of surgery or injury of the lower extremity, when a doctor or physical therapist will teach a patient to do ankle pumps because they're constantly trying to use the calves to pump the fluid out of the lower extremity back to the heart to drive down inflammation, get that exchange of new fluid coming in and old fluid going out to bring again those nutrients and that oxygen and to get those waste products out. Now, isometrics can help calm overreactive nerves and provide an analgesic effect because it's driving a conversation. It's forcing the brain and the muscles to have the conversation of how much can I contract before I'm sensing pain. And it helps the brain reorient, reconfigure, reevaluate, and understand how much load it can expect the muscle to fire, to contract, and not cause further harm. Rhythmic movement is the same thing, and that would be a conversation for really a different time to really get into because we haven't talked about it too much. But that would be something that also could help calm overreactive nerves and provide analgesic effect. But basically, it's the idea of having somebody else provide resistance in alternate directions to a limb. So it's basically an isometric contraction, but the direction in which the force is being applied to a limb changes directions, forcing in the isometrics. It's forcing different muscles to fire isometrically instead of just one muscle to fire isometrically for a sustained period of time. Progressive loading is what's necessary to help stimulate the tissue to remodel and to have proper collagen alignment as a patient recovers. So this would be the idea of going in and using the isometrics also to begin loading the tissue to encourage correct collagen fiber healing in the correct direction. Basically, you're educating a uh, piece of connective tissue that has no uh, it's not smart. It's not trying to contract. It's just trying to go in there and provide increased stability and help provide healing. And by going in there and repeatedly loading it in one direction, you're teaching the collagen at a very basic level to resist being pulled in that direction, but to also get used to being pulled in that direction. You're basically educating the collagen, hey, welcome to the area where you were just laid down. You're helping rehab from an injury. You need to get used to movement in this plane or this direction or with this load. In other words, targeted and specific movement from a physical therapist helps organize the chaos of the body healing. It tells your body, one, it's safe to move again, two, it's safe to move again this way, and three, it's okay to accept this amount of load. When pain begins to fade with movement, it's not necessarily because the inflammation has suddenly vanished. It's because your brain and your muscles and your nerves have been recalibrated to accept the load and to complete the task to return to the previous level of function they were at before. Now let's take a look at fluid and viscosity. Remember that we spent an entire episode talking about tissue viscosity. When inflammation increases, that makes the fluid thicker, almost syrupy like honey, and that viscosity slows down communication between cells and it makes movement feel much more stiff or achy, right? It's increased pressure on the muscles, it decreases their efficiency of firing, and it makes them have to work a lot harder to accomplish the same motion before. All of that gets fed back to the brain or through the nerves, being said, hey, I have to work a lot harder. Feels a lot tighter. It's a lot more difficult to move. I get a lot more resistance from the fluids around me. Also, all this pressure on my nerves, yeah, that's making me feel like I'm super achy, super sore, and painful even. And all that's going to dial the brain into pay more attention. So the very change in viscosity or thickness of the fluid in and around the muscle tissue or the area of trauma is going to lead to the brain perceiving that differently. It's also going to change to the, again, like I said, the efficiency of any sort of muscle contraction in the area. But the part that where physical therapy comes in, the cool part, if you will, is when a person moves, stretches, and loads the tissue gently, you increase, one, like I said earlier, the fluid exchange that gets the viscosity to decrease, but you're also going in and getting the muscles to have that conversation with the brain of, hey, I'm okay to be loaded. It's just a lot more difficult for me to load. But then the more that you get loaded, the more that you go in there and you do motion and blood flow gets in there and the fluid exchange happens. And say, for example, a physical therapist goes in there and does soft tissue mobilization and all those things, you're actually driving down the viscosity, enhancing nerve conduction, returning back to, again, that homeostasis. So literally by going in there and providing targeted movement, soft tissue mobilization, etc., it changes the state of the tissues mechanically, chemically, and neurologically by reducing that viscosity. Now, the role of the mind is another important thing. The stress, a perception of what's going on, and the idea of safety. The brain has, one, a very important role in all this process, but it also has an incredible ability to choose to either to amplify or reduce its perception of the inflammation based on whether or not it perceives it as a threat versus a process. So chronic stress, anxiety, poor sleep are all going to increase pro-inflammatory cytokines and hormones that will slow down recovery. It's also going to make your brain, with less sleep, a lot more likely to be entered into that threat phase where it's expecting a threat. On the opposite side of things, feeling safe, supported, educated, understanding what's going on, understanding it's a progress, can all help lower that sympathetic response and drive up inflammation and pain sensitivity. And it really does come down to the perception of the brain of what's going on, like I hinted at earlier. If the brain knows that a tissue has been injured and it continues to choose to perceive that as a threat, a significant life-altering threat, then the likelihood of the person perceiving pain even with isometric exercises, is going to be significantly high because the brain is operating, usually in this case, with either poor data or very few data points. After surgery, if you have no idea what the surgery was, what they did, what they reconnected, what they disconnected, what they wore down, replaced, whatever, everything in the whole world going on around that joint can be scary and be a threat because you have no idea if that joint is hanging on by a thread or if it's been firmly cemented in place and is never going to move again. However, if someone comes in and educates, hey, you had a small tear in this muscle that was actually gone in and repaired, you're going to be able to probably get back to most of your movement within 8 to 12 weeks. And we also saw maybe a little bit of arthritis in the joint, but nothing too bad. But expect to struggle with these two motions and expect to have decreased range of motion here and here for a few weeks before we get back to normal. That provides the brain with a boatload of information, and it helps it do what? It helps it perceive the injury as a process, not a threat. It's a progression, not an end state. That's one of the most important things about perception is one, understanding what's happened, two, where to go from here, three, the movement is okay. As physical therapists, one of the most important things anyone can do, as a physical therapist, is to understand that the mind and the body are connected, that teaching patients how to breathe, move, and understand their pain and perceive the process of healing of what's going on creates an environment and a mindset where healing is actually encouraged and the brain has a roadmap going forward. It's no longer expecting this to be a threat. It's now expecting it to be a process. It's not a bunch of hokum. It's not soft science. It's not pseudoscience. Instead, it's all about pain science, and it's about the mind and muscle connection and helping the brain understand what's happened to the body, how to perceive all the cell signals that it's receiving, either from the muscle or from the nerves or from whatever, and in order to figure out how to adapt to it. So then, at the conclusion of all of this, what does it mean for me? What does it mean for you? What does it mean for everybody or anybody that we know that's going through this process of inflammation? It means inflammation's not the enemy. It's simply a biological process to initiate healing. Movement and loading that physical therapists do, it's not a cure, it's communication. It's driving the communication between the cells, between the muscles, between the nerves, and between the brain. And that healing, it's a roadmap, it's a path, it's a process. It's not something that's going to happen overnight. It's something that happens day by day, exercise by exercise, stretch by stretch, step by step. It's a partnership that exists between the cells themselves, the tissues that the cells make up, the nerves, the muscles, and the brain, the person, and the physical therapist. It's not something that happens passively on its own. It actually takes quite a bit of action. It takes a lot of activity, and it can take quite a bit of focus. So, when a physical therapist is going in there and moving the body, encouraging deep breathing, and trying to figure out how to load the patient appropriately, the truth is all the physical therapist is doing is going in there and teaching the body to trust itself again. And that's really the essence of recovery. It's driving a conversation between the patient's body and the patient's brain, walking that patient through range of motion and strength and loading in order for the brain to trust the body and to know that the muscles, tendons, tissues, bones, etc. can get back to doing what they were doing before. So, thank you so much for tuning in for this final episode of the inflammation series. I really appreciate you guys being here. I hope you found it enjoyable. I hope you share it with the people out there that need to have this mindset. And that through this 7-part series, we all learned a little bit more about the natural healing process that the human body likes to undergo and how physical therapists can help contribute and improve and enhance and speed up and provide more value and benefit and education to people in order to have the best outcomes they can. So as always, everybody stay healthy, stay fit, and stay awesome. Yes, I got it that time. I messed up last time, but I got it this time. And I will catch you all in the next episode.